Well, there's no secret there'll be a little drinking going on in Savannah this weekend during the St. Patrick's celebration. But when does a little fun become a big problem?
Signs of problem drinking often show up during holidays like St. Patrick's Day. Here with some ways you can tell if a loved one has a drinking problem. Danielle LaPointe of Hilton Head Island's Sunspire Health. Good morning.
Good morning. How are you?
Hey.
You know, you would think that during the holidays isn't a great time to find signs like that because everybody's having, might be having a little bit of a good time. But that really is a very good time to figure it out, isn't it?
Absolutely. I mean, in Savannah, you guys know this better than anybody else. Last year, I think we had 611 alcohol and drug-related arrests within the proximity of the parade on St. Patrick's Day. We fished 3 alcohol-related arrests from the river. Wow. in and of itself. So, between DUIs, possession charges, underage drinking, there's just a lot of opportunities to identify whether or not somebody has a problem with alcohol and drugs. Now, don't hear what I'm not saying. I'm not saying that just because somebody gets a DUI that means that they have a substance use disorder.
Sure.
But it is indicative. It is a red flag that we use in our field to determine whether or not we need to move a little bit further in the assessment process.
So what are some, warning signs that a family or loved one needs to be looking out for and thinking it might be time to get some help?
Yeah, absolutely. I think what we would be looking for is there's 11 diagnostic criteria. And 3 of those criteria they pertain to negative consequences. So for somebody who doesn't have a substance use disorder, they would learn their lessons. If they got a DUI or an alcohol-related arrest in college, then they know how to handle St. Patrick's Day, the healthy way or the appropriate way. But for an individual who has the brain disease of addiction or alcoholism, they have an imbalance in their risk and reward factors. What I mean by that is, to them, the euphoria and the intoxication is much more valuable than the risk of potentially getting arrested again, or the risk of having any negative consequences. To the alcoholic, when the doctor says your liver is going to fail if you don't stop drinking, the euphoria of intoxication is much more valuable to them than the risk of the doctor potentially being right. And so for somebody with this brain disease, their chemistry is a little off kilter, which causes them to make bad judgment calls. And that's why I think so often we assume that this is a bad boy, bad girl type of thing. It's a behavioral issue, and it's not. It is truly, there is an imbalance in the brain chemistry. That is why it's a disease. And I look forward to this relationship with you guys, and I'm so grateful that you guys had me on so we could help reduce that stigma. So when people do have a problem, they know where to go and find help.
Is alcoholism always excessive drinking, or is it maybe just a little bit of drinking all the time?
It is a little bit of drinking all the time and excessive drinking.
It could be either.
Okay. Right. It's an and but, right?
Okay, yeah. So again, somebody falling down drunk is not necessarily a sign, because that doesn't necessarily mean that person is always like that.
Exactly. And especially if that only happens once or twice a year. Yeah. If somebody is falling down drunk every weekend, chances are they need to have a conversation with a medical professional.
Excellent. So what exactly does your office provide?
Yeah. We do treatment on a 30-day basis, and then we provide a continuum of care, because we know that putting somebody in a bubble for 30 days and just detoxing them isn't the best outcome, doesn't have the best outcome, so then we provide that aftercare service as well. This is a lifelong disease. Just like cancer, it can go into remission, which with the proper treatment and care that we provide, and other treatment facilities do too, it can be in remission after that 12 months. However, the first 12 months of somebody's recovery are the most, you need to be the most aggressive with treatment. Okay. So between therapy, which gets to the underlying core issue of the disease, and also medically assisted treatment, which could provide anti-craving medication or some SSRIs if there's some depleted dopamine levels, which causes people to be just sad all the time. And nobody wants to live like that, It should be beneficial to quit drinking and using drugs. Yeah. So our medical team does a great job making sure that people have a high quality of life when they find treatment.
You're on Hilton Head Island.
We are.
How can folks get in touch with you?
All right. Well, we have a website, and we love people to go and check us out on the website. There are opportunities to find one of our clinical staff members who are on call 24 hours a day, 7 days a week. We believe that it always starts with a conversation. Just like any other disease, you go to the professionals who know the disease the best, and you start a conversation with them. And so you can find us at www.sunspirehealth.com, and then we have a dash Hilton Head.
Excellent.
Great.
Danielle, thanks so
you.
much.
Thank you,
Thank
Danielle.
you. Okay.